first MRI with the blood, and then yung CT scan mo. Wala na, this is the area of your malformation. So, wala nang dugo. So, to make sure good, ano, pwede na actually to treat you whenever. Your, ano is out na. You were operated September 10. September. So, so what, your malformation is somewhere here. Try to compare it. So,
yun, kita mo yung white.
So, dito banda yan.
Yan.
Dito banda yung malformation. So, what we want to do is to treat it. Now, there are several ways. I mentioned before, no? Tatlong ways of treating this. The first question is, do we have to treat you, di ba? Kasi you're only 19. And because you're only 19, the risk of this bleeding again over the rest of your life is a little high. No? You can actually download an app that will calculate it. Sabi ko mga 75%. 76%.
Kasi yung una kasi, ang nagpang-ano sa inyo kasi yung father niyo.
Okay, anyway, the medyo sizable kasi yung risk mo kasi medyo bata ka pa. If you were 90 instead of 19, sabihin natin, na lang. Okay? Diba? So because you're young, the risk of this bleeding, although the yearly risk is small, maliit lang yung yearly risk mo. Over time, umilit yung risk. And we don't want this to bleed again because it will cause more problems. So right now you're still having trouble walking.
Yes.
Okay. So we don't know. I'm hoping mag-repair po yung mga areas dito na damage po ng dugo. Let's hope that turns out well for you. What we're trying to do lang, the reason there's an intervention is to try to prevent this from bleeding again. So there are three options. One is operation. Okay, you go in, you do surgery, and you take it out. The problem is, yung AV malformation mo, napakalalim. So, kung ito yung malformation mo, nandito sa gitna, halos.
Ang lalim.
Okay? So, medyo mahirap pong abutin. Okay? Maaabot naman kung maaabot. Medyo malalim kasi marami kang dadaanan to get to that malformation. And then the feeders are also deep. So, mataas ang risk for complications. Okay? So, that's one of the ang advantage ng surgery kung successful siya, tapos na yung problema mo right away. But you might have complications in the surgery. Now, the second option is something called embolization. So, embolization parang angiogram. You remember that? Okay. So, yung angiogram, they take this very small tube, no? And then they put it inside. Okay. There, see, that's a tube up here. See yung tubo. So, naglalagay sila ng dye, nakikita sa ugat. What they have is a smaller tube pa. And they push the tube up. This is the wrong picture. Okay. So, hindi kita yung tube nandito. But what will happen is they will push the tube up all the way hanggang dito until they find the feeders, and then isa-isa nilang hahanapin, ilalagyan ng parang semento
Okay.
So that hindi na dumadaan doon yung dugo. Kasi
Dugo.
problema, may abnormal na connection.
Magbablock na lang yung
So, babarahin nila. So, that's called embolization. They embolize the bleeder. Ang difficulty doon naman is, kung maraming feeders po, baka hindi man ma-embolize lahat. Nahanap ko yun. Naka-separate kasi yung isa. Kaya yeah. Ayun, yun na. Okay, so this is the front view. So, papasok dito after sila, ganun, until they can find all the small feeders. There's one here, I can see at least two. Maybe there's more. So, hahanapin, then they'll put embolic material inside para may sara nila. So that's one option. Okay, we don't do that here. But ang advantage ng embolization is if it's successful, tapos na rin yung problema mo kasi nabarahan na. There are issues about it reopening. Kasi minsan na-embolize na pero nag-reopen. This depends on the material they use. So, when you were in Ceres, did they mention this to you, embolization?
Pero hindi po nila sinuggest yun kasi...
Ano na?
Hindi po nila sinuggest.
Usually kasi, well, that's an option.
That's an option lang po.
The third option is yung gamma knife. Kaya kayo pinapunta rito. The advantage of a gamma knife is, well, we won't need to do surgery. It's less invasive. So, we still have to do an angiogram on the area of the gamma. Yes. Because we need this para makita natin yung exact size ng dugo. So, the angiogram is really important.
Okay.
So,
Again.
Kasi that's the way you can know. Kasi if you just use this, you may not see the whole thing. Or minsan, usually sa MRI natin sinisilip yan. So, when you do an MRI or, you may not see everything. So, this is the malformation. But it doesn't tell you which are the veins, which are the arteries. So, you only see that here.
Kailangan yung angiogram.
Makikita yan sa angiogram. Are you dealing with a vein or an artery? So, you can actually outline the malformation well. So, in a gamma knife, what do? We attach your head in a frame, okay? Because what we're going to do is we're going to put radiation in your head. It's going to be focused at the malformation so that what happens over time is bumabara. How do you put it? Kung ito yung blood vessel wall and you put radiation on it, over time it scars. And so as it scars, lumiliit yung butas. Sumasara kasi kumakapal. Okay. When that happens, hindi na makadaan doon yung dugo. Diba? So, nabarahan mo na rin yung malformation. So, when you do a gamma knife procedure, over time, that happens, it takes some time. Okay? This is a small malformation, so mataas ang chance. Chances are higher that it will turn and obliterate. Okay? But it's not 100%. Lang 100% talaga. For small ones like this, we're looking at an 85 to 90% chance na baka sumakas siya in about 3 or 4 years. So, pag nag-gamma knife ka, hindi ibig sabihin sarado na siya right away. You have to wait. And over time, we're going to do regular MRI for you. We're going to observe this. And usually at 2-3 years, most of the small malformations, we won't see it on the MRI anymore. And to verify na talagang wala na, we're going to do another angiogram. If the angiogram is negative, okay. Pag negative na angiogram, tapos na. Okay. If angiogram, meron pang nakikita, we'll wait a little bit longer, maybe a year, maybe 2 years. Then ulitin natin yung angiogram. Okay. Now, by that time, we're looking at 4 years, 5 years, close to 90% now. A little bit more, might close already for small malformation. If it still is not closed, ang option natin is we'll do another procedure. dadagdag will do a second gamma knife.
A second
Para
gamma knife
i-close.
para close ulit.
Pero kung sana.
Pero yung risk naman po is ano no? Kasi small naman yung ano
Oo.
niya.
But there's always the risk. So anong risks involved? I mentioned yung sa possible complications. Pwedeng mamaga yung surrounding brain. Okay. Pero for something this small, while it can happen, it's probably not going to be as severe as if it is a very big one. I have question.
Takot siya sa angiogram kasi.
Wala tayo, hindi natin may iwasan. That's the gold standard of diagnosis. So, if you don't have an angiogram, you never really know.
Kasi dun yung basis talaga, hindi kagad sa MRI.
Oh, you have a question?
Ay, hindi kasi po, Doc, ano siya eh, bakit kaya yung gamot niya kasi kung ano pa rin, kasi minsan nagsisseizure siya, nagsisseizure pa rin siya. Tsaka Kepra, tsaka yung Pregabalin ba yun?
Pregabalin, bakit dalawa?
Kasi po, stroke po yung kanan.
Yung sa kanan niya po kasi.
Yung weakness mo is because ng karoon ng bleed. So, if you look on, I don't know if you can show it here.
Yun yung cause po ng ano niya.
See, on this side.
Right side.
This is the left, this is the right. So, on the right side here, hindi mo makita, but nandito yung motor fibers mo. On this side, pag ganun yan dito, natamaan siya, most likely, naipit siya ng blood. So, I don't know, at this point, hindi natin masasabi if the motor fibers na putol ng blood. Because, siyempre, may pressure. Or the damage is permanent or not. It's still very early kasi this happened in August, diba? August, September, October. So, 3 months pa lang. So, you have to do urine. For sure, pinapahirap ka, diba?
Hindi pa po siya eh. Kasi yun nga rin po yung tatanong namin kung pwede na siya magpa-therapy.
Yes, so as long as the people who are doing the therapy, you go to a physiatrist, no show with AVM, so they can adjust the exercise. Okay, so it's important na mag-rehab ka because you want to encourage na mag-reconnect yung mga
naputol, kung may naputol.
Kung anong na-damage, you're hoping to reconnect them or to encourage the brain to make new connections. Kasi bata ka pa, you have good chance na mag-improve yan. So, anong tanong natin?
Yun yung ano niya, kung bakit.
It's because of this, because of the damage in the brain.
Okay.
So, what we're doing with the gamma knife, we're not going to correct the weakness. Kasi, what we want to do is just prevent this from bleeding again.
Okay.
So, yun ang habol natin. The other thing that has to be told is while we're waiting for it to close, there's still some risk na baka tumulo siya ulit. Well, that's if you want it to close right away, then your options really will be surgery, open surgery, and embolization. If you want to explore embolization, then we'll have to refer you to someone who does the embolization para he can talk to you and you can para makapag-decide. Usually, our own experience is we don't, unless they're very, very small, we don't usually send them off to embolization. So if you want to explore it, I can refer you to someone who can look at embolization.
Pero hindi kasi, pero tawag dito.
So, yung Kepra mo at saka Pregabalin is supposed to be for seizures. Nag-seizure ba siya?
Nag-seizure pa rin po siya kasi, opo. Lately,
sumasakit po.
pag sumasakit po yung sobrang
So, pag sinabing seizure, what happens?
Yung unang seizure ko po is, yung antidote po ako. Kaya natatakot na po ako ulit.
Can you describe, when you say nag-seizure ka, anong nangyari?
Nanginginig po yung buong katawan. Tapos,
titigas.
nararamdaman ko po, tumitirik na yung mata.
Nawawalan ka ba ng malay?
Tapos, after po na nawala na po ako ng malay. Pero alam ko po muna talagang nagpapanik na po yung mga doctor ko that time na
Actually, ang kanya, basta naka-Kepra ka ngayon, you keep it in. When was the last time you had the seizure?
3 days ago.
3 weeks ago.
3 days lang. 3 days.
3 days.
Hindi, everyday. Alas kasi ano
Kahapon,
eh.
hindi.
Oo nga,
No,
last
pag sinabi mo, how much Kepra are you taking?
2 times a day.
2 times.
No, how much?
Ah,
500?
Oo.
500 po ata.
500.
Hindi ko po sure eh, kasi hindi ko namin alam.
Hindi ko dala yung ano niya kasi.
So, the idea is when you have seizures, you have to try to control it. Kung why you're having seizures, kasi yung lalim naman ito.
Kaya po yung ano din namin, kung pwede rin kaming kung pwedeng palitan yung gamot niya.
Sino yung bigay nila?
Sa Jose Reyes.
Serious?
Ay, sa Jose Reyes, sa heart center.
Philippine Heart Center po.
Oo.
Kepra binibili nyo.
Opo. Pero nung isang Kepra po.
Ang kwan ko dyan kasi, I don't know, wala kayong dalang no?
Okay, kasi sabi rin po kasi yung reseta, kung pwedeng magpagawa ulit na reseta.
Kasi po, nawala po ng husband ko.
Na-misplace ng husband niya.
Okay, kasi, I don't know your dose eh. Sabi mo twice a day, but you don't know how much you're taking.
Hmm.
Usually if you're